Okay, so I'm about to perform a head-to-toe assessment. Before entering the patient's room, I would look at his chart. I look for any tubings or drains or anything like that before entering the room, so I am prepared for any of that type of care. I would look for any allergies or any complications for this patient in his chart. I would also look for any isolation precautions before entering the room and anything else that pertains to the patient. So I'm prepared before entering. I'm going to knock on the door. Hi Madison, I'm going to be your nurse today. I'm going to perform a head-to-toe assessment. I'm just going to kind of look head to toe, basically, kind of assessing everything to make sure everything looks good in normal ranges. And now I will perform hand hygiene and then give the patient privacy. And can you tell me your name and date of birth for me?
Travis Ty Kennedy, June 27th, 1996.
Okay, and then on a pain level, 0 to 10, 0 being none, and 10 being the worst pain you've ever felt, what would you rate your pain as?
0.
Okay, and then I'm going to be looking for symmetry, and his face has symmetry. I don't see any abnormalities in that way. And then at this time I would take vitals, but for the sake of the video I would not perform them. And then I would also look for skin impairment and how the skin integrity looks, and the skin is cool/warm and dry. And then I'm going to look at his scalp for any lumps or bumps or any wounds or any lesions that I might find, and make sure that hair is equally distributed, and that's what it appears to look. I don't see any of those things on him. Can you tell me the day of the year?
March 4th.
And then can you tell me who the president is?
Donald Trump.
The patient is alert and oriented and has a good level of consciousness. His emotional status does not look in any abnormal way. He seems relaxed and comfortable. And then I will assess for your capillary refill. And it was less than 3 seconds, which is what I want to see on both hands and feet. Now I'm going to look at your ears to make sure everything looks normal. And then in your nose, and then in your mouth. And mucous membranes look pink and moist. And I'm going to shine the light in your eyes twice to look for pupil reaction, equalness, and reactivity, and consensualness. And his eyes had all of those things. His pupils were reactive, responsive, and equal. And I would document Pearl in his chart. And now that I've assessed the head, I'm going to move on to his swallowing. Can you swallow for me? And then cough. Okay, now that I have finished the upper half of the body, I'm going to move down to the heart. And then listen to his heart sounds. I'm going to start at the sternal notch and then work down to the second intercostal space to listen to the aortic valve. Now I'm going to listen to the pulmonic valve. And now to the tricuspid, which is in the fourth intercostal space. And then now to the mitral valve in the fifth intercostal space. And here I would listen for the apical pulse, but for the sake of time of the video, I will not listen for a full minute. Everything sounds good. And I'm going to listen to your lung sounds. And the lung sounds clear. And before I proceed any further, I want to ask if you have any allergies.
Penicillin.
Okay. And then I'm going to assess your bowels. Have you had any bowel movements?
Mm-hmm.
And you've had urination?
Mm-hmm.
No pain or discomfort or any concerns you'd like to address? Okay. So now I'm going to listen to bowel sounds. I'm going to listen for 5 to 30 seconds or until I hear any activity. And I heard bowel signs in all 4 quadrants, and I don't see any issues on in the bowel area, no pain or anything when I press down. I didn't see any of that, and I'm going to check for pitting or edema, and I don't see any of that. I'm going to check for skin turgor, and it has good elasticity. I'm going to check up here too, and there was both good elasticity, so I see good hygiene, good nutritional status, good skin integrity overall. And now I want you to hold my fingers and grip them. And there was good grip. And now I want you to put your hands in the air and kind of roll your wrists around and move them. Good. And now push on the hands and then push down. Good. And then I want you to do the same thing on your feet. Good. Then push up. And then now I'm going to test for your your dorsal pedialis pulse. I can feel both of them and they feel normal. And I would normally listen for 30 seconds, or if I found any abnormalities, a minute. And I'm going to check the posterior tibial pulse. And I can feel both of them. And again, I would listen for 30 seconds or a full minute if I found any abnormalities. And so I didn't see any abnormalities down there. And then I want you to sit up for me so I can listen to the back of your lungs. And then breathe in. Lung sounds on the back are clear. And then do you feel dizzy?
Mm-hmm.
I'm going to have you stand up and walk to the door and back. Gait is steady and posture is good. And you can sit back down in the bed. So I found good range of motion, no impairments in that order. So I've assessed his head and scalp and his eyes and ability to swallow and to cough, and I didn't find any abnormalities. He did have an allergy to penicillin, but that wasn't part of the treatment for today. And I checked for his heart and his lungs and his bowels. And then I checked his skin, and his skin looks good for his ethnicity. I don't see any issues with that. And he seems to be able to hear okay and be able to communicate with me, and no impairment in that way. Didn't address any concerns. I didn't see any edema or vascular issues from what I could tell. And I could feel both pulses, and at this time I would document my findings and talk to the healthcare provider about any concerns or questions about the patient, and then I would document.